good afternoon, everyone, and welcome back to another captivating episode of Mind Split Cafe. And of course, we have Matt back with us today. Matt, thank you for coming.
Always. What's going on, guys? Sorry I missed last week, but it was a great episode. It was really, really good. So Chris held it down. So I'm
Absolutely.
back.
I appreciate it. Hopefully, Ollie's good now.
Yeah, Ali's great. He's good.
And today we actually have Dr. Hernandez, who is a psychiatrist with Palms Behavioral Health. Dr. Hernandez, you want to say hello to the listeners and kind of give us a rundown on your credentialing and what we'll be discussing today?
Sure. Hi. Well, thank you for having me. First of all, my name is Dr. Michael Hernandez. I've been the medical director with Palms Behavioral for the past 2.5 years. I've been a practicing psychiatrist for the past 18 and a half years. And I work in a variety of settings, both inpatient and outpatient, and just enjoy what I do. So
I
I'm
love it.
glad to be here. I'm glad to just share a little bit more about mental health.
I love it. I love it. Doc, your energy is amazing. Doc is bringing it today, this episode. I can already feel it. No depression here. No depression here. So
Nor coffee.
nor coffee. Yeah.
I got mine. I don't know about you.
Oh no, my cup had a hole in it this morning, so it just had to go. Had to
Oh
go.
no. That's depressing. Boom.
Pretty much.
Well, let's get started. So I know that there's a few things that we want to discuss, but I think we're going to start with depression. So let's get a little rundown on depression and start firing some questions your way.
Sure. I mean, I'd like to talk about depression specifically because it is one of the most common mental health issues that we deal with, and one of the most common diagnoses that we have in the hospital. And I mean, it's very common amongst adults. 1 in 10 people, adults, will have depression within the course of the year, and even more adolescents will have a higher percent of depression over the course of the year. And I think a lot of us get familiar with depression, but it's more sometimes the symptoms that we're not quite used to, and we got to recognize that's depression too. And perhaps maybe some people need a little help.
So what are the symptoms? What are the typical main symptoms of depression?
Yeah,
So
you took the
typically,
question. Yeah, you took the question right out of
oh,
my mouth, because I was like, what are the, if we're going to talk about the ones that really aren't seen, are really kind of unknown, or people aren't familiar with, the everyday people, I'd like to know what the everyday symptoms are that typically people know about, and then we can kind of show the difference, right? So great question,
sure.
Chris.
And yeah, and so commonly what we see is the depressed mood, the just sadness, the crying spells. Other common things are loss of interest. Things just aren't fun anymore. They're not what they used to be. We might see trouble with concentration, a decrease in your energy, and sometimes we get just these feelings of worthlessness or excessive feelings of guilt, and we really can't explain it. And then, of
Wh-
course, there's always that aspect of suicide thoughts. Yes.
Yeah, let me ask you a question, and not the suicide, but when you said the feelings of guilt, or worthlessness, right? Like,
Yeah.
um, would imposter syndrome be a, I guess, I don't know how to say it, but like a kind of an indicator for depression, right? Because I myself suffer from imposter syndrome. I'm self-diagnosed, right? But but the research that I found, it like I suffer from all the symptoms, right? And feeling of inadequacy, or feel like I'm a sham to everybody else, whatever, right? But when you mention the feeling of like worthlessness, or that sort of thing, That's immediately came to my mind because I'm just curious.
Sure. So to go down that tangent, and when you first said imposter syndrome, the first thing that popped to my mind is what I more commonly see is people who believe that others are imposters, that they're not who they say they are, or they've been replaced even.
Mm-hmm.
Like that's not my husband, it's someone else, and so that that's usually either a psychotic disorder or sometimes occurs along with dementia. I think I'm glad you added more to what you're feeling
Mm-hmm.
or been experiencing, and so I think that would someone experiencing those sorts of symptoms would be more prone to having depression, and it's kind of feeling like you don't belong here, like I'm a farce, and
Exactly.
somebody's gonna find out eventually
Exactly.
that, hey,
Yep.
I'm a screw up,
Yep.
So
I'm
that
not
I think
I'm just letting the audience know, our little audience. I am not a farce and I am not a screw up and I'm not fooling anybody, right? But I am talented and I am worthy. But I'm just telling you, I have these bouts like once a month. I go through it, and it's
At the
just
end of the month too.
at the end of the month. It's the last week of every month. I go through it, and it's crippling. It's really crippling.
so I think that will probably fall more along the lines of self-doubt.
Mm-hmm.
And that's where I think one of the most useful things to help with that would be individual counseling, challenging these negative thoughts, sometimes doing an inventory checklist of, hey, this is what I have to show me otherwise,
Mm-hmm.
to just to combat those negative thoughts.
Hmm.
So sure, and that's a common thing. I mean, and don't get me wrong, we've all been screw ups in our lives, and myself included, at some point,
Mm.
Very
even
true.
if it's recent.
I love how you threw that one in there. That was good.
Mhm.
So, I haven't really been in touch with my emotions until just recently, and I feel a whole range of emotions throughout the week. So, what's the difference between like a typical mood fluctuation and clinical depression? Because I mean, they can be kind of similar, but there are things that differentiate between them. What can you go over those?
Yeah, absolutely. So, I mean, let's say all of the symptoms I mentioned, you experienced them all today or yesterday,
Mm-hmm.
and it still wouldn't necessarily qualify as clinical depression because what we're looking for is these symptoms persist over, really 2 weeks or longer. And so, in a sense, it's getting stuck. Get stuck in these negative feelings, negative thoughts. I mean, because we can have negative thoughts throughout the day. I mean, it
Yeah.
happens, negative emotions. But it's when we start getting stuck and it starts causing interference in how we function socially or how we function at work or or how we function at school for, our college, adolescents, and, whatnot.
Okay, that was good. So
Yeah, so fun. I mean, just to throw this in there, for most psychiatric diagnoses, they do have to interfere with your ability to function, really, to qualify as a diagnosis.
okay, so if it impedes my ability to focus at school or to do my job, then that's when we start looking at this may be clinical depression. And if it persists over 2 weeks, that's when we know it's clinical depression.
Correct.
And what does the treatment plan look like for someone that's coming in for clinical depression? And we've already passed the 2 week mark and we know that it is clinical depression. What happens after that point?
Sure. So a lot of it comes to history and what, how long it's been there, how many times it's been there, because if this is your first go around, you've never had any sort of treatment, we always want to look at the least invasive treatment. And so sometimes, I mean, it's lifestyle changes, sometimes it's exercise, nutrition, counseling is very important. And then we need to look at medication. I mean, and
Mm.
so usually by the time someone makes it to me, we're considering medication, but it doesn't have to be. I always just advise people to be honest with themselves. How long have they really experienced this? How impairing is it really? And what type of treatment do they need?
And when you say that maybe a change in lifestyle, do you think social institutions play a role in someone being depressed or not being depressed, like the school they go to, the church they go to?
I think how we internalize a lot of negative things or perceive negative things can affect your mood. And so then if we can maybe do some of the things that get us feeling better, some of the things we feel more uh, industrious at, that we can start feeling better.
Gotcha. Makes sense. So, kind of going backwards a little bit, I know we're going to be jumping quite a bit around, but going
That's
back,
okay.
can you elaborate on some of the less common symptoms that we or someone experiencing clinical depression might feel?
Sure. So one of the things to recognize that the fundamental, what we think depression, sadness, depressed mood isn't always there. And what we see maybe a little more common with males compared to females is anger, irritability as the
Mhm.
primary symptom. And you
Mm.
can ask them, do you feel sad? Have you been crying? They're like, no, but I'm just mad all the time. I get mad for any little thing. And, maybe I throw things, break things, or maybe I'm just yelling and I'm starting to really cause problems in my relationships.
Mm.
So that's something we might see with males and also see with the younger population compared to an older population.
Wow. So
Interesting.
what if people, I mean, I'm blown away, right? I have so many questions, but I guess the main question is, what is a way if someone doesn't have access to therapy like you do, like someone like a professional like yourself or like Palms, right?
Mhm,
Um,
mhm.
for whatever reason, whether it be they might not have medical insurance or maybe it's a pride thing, um, whatever the case is, right? What is maybe something that our listeners could do to kind of help? Yeah, I mean, help themselves. Where if they've identified it and they say, you know what, Dr. Hernandez, he was right. He was right. I probably have something similar to this, but I don't want to go to the doctor. I can't go to the doctor. Whatever. I mean, is there meditation? Is there yoga? Is there talking to friends? Like what would kind of be a home remedy, so to speak, to
A holistic approach.
and holistic approach to try and combat what they might be going through.
I would say yes, yes, and yes to everything that you mentioned. Because it gets back to trying to decrease your stress and trying to challenge your thinking, trying to challenge the negative thoughts that you have.
Mm-hmm.
Now, sometimes though, that also comes negative thoughts that we have against treatment. Because sometimes it's pride, sometimes it's fear, but that we avoid treatment, even though it is there. And there are plenty of access points to health care that even if you don't have insurance, you can go to,
Mm-hmm.
including your local mental health authority. But as far as if you're saying, no, I don't want to try that, I want to go other approaches, uh, things like meditation can be helpful, stress management, proper nutrition, exercise over the years has always been proven to be effective for treating depression, especially when we're talking more in these milder states. But this is that part where I say is be honest with yourself. If you're doing all the right things, And this is true with, say, managing diabetes. You're doing all the right things. You're exercising, you're eating right, you're counting your carbs, everything, getting your right sleep, and your blood sugar's still high. You need medical treatment.
Mm-hmm.
And so the same would be true for depression. I'm doing everything right. Socializing can be helpful for depression.
Mm.
But when it's all not working, okay, time to get help.
Yeah, it's time to do, yeah. So even though you identify it early and whatever factors are getting in the way from you getting actual, medical treatment or professional treatment, at some point, if
Mhm.
everything is being done and it's still an issue, then it's time to put your pride aside for whatever reason and really, really, let the professionals handle it and seek out some guidance.
Absolutely. And the other part is to recognize too that counseling can make a big difference.
Yeah.
And, where one of the things that, when, people come to Palms Behavioral, and I'll tell them is that if nothing else helps, what I hope that you recognize that talking about things will help you.
Mm-hmm.
And if that's the only thing you leave with, I talked about my problem and I'm feeling better because of it.
I love that. Yeah, I love that. Now, how long have you been with Palms?
2.5 years.
Fantastic, fantastic, fantastic.
Yeah,
So,
but I've done inpatient work for basically most of my career.
Are you originally from the Valley, or are you a transplant?
I'm a transplant. Originally, I'm from San Antonio, born and raised,
Okay.
and I
Go
practice in
Spurs.
Go Spurs, go Spurs,
Rockets,
go for
Rockets.
another high draft pick, please.
The stress, the stress. It was some depressing years for it was a couple of
For a
depressing years
long,
there until they got Wimbenyama, right? So
I don't know. I
that's
think it's
right.
still the best thing.
yeah.
It's a work in progress.
Yeah, Coach Pop is a wonderful person, man. I have the pleasure of knowing him, and he is such a great human being. Like, really, really great guy, really great coach. It's very few people you can find that will speak ill of Coach Pop. He is a wonderful person. He's helped so many souls like yourself, like and your colleagues there at Palms. So yeah, Coach Pop is amazing.
So I have a question that might open up a wormhole. Um,
Sure.
but when they get to you, when a patient gets to you and it's medication time, what types of medication are you prescribing, and what do they help alleviate? If you can go into detail about that.
Sure. So, I mean, most typically we are prescribing antidepressant medication. They usually take around 3 to 4 weeks to work, and really a good 4 to 6 weeks to see the full response. Now with the hospital, people are usually there. They're not maybe necessarily fully better from the depression standpoint as far as medication effectiveness, but they're safe where they're able to transition to a lower level of care. They can go to the partial hospitalization program or just go to an outpatient program. Now that said, there are other medications we sometimes add to depression medicines to get them to work better, work faster. And then, I mean, it's not to forget the role of therapy in treating depression, because that in combination with medication does better than either alone. And then there's still some other type medicines we add too when things just aren't working the way we need them to.
So it's kind of I don't want to use this term, but for lack of better words, a trial and error to get the
Mhm.
correct cocktail down, correct?
In a sense, I mean, and so a lot of times is people have a history of being on different treatment, and you try to get an understanding of what their experience were, what worked, what failed, why did it fail, and then you try to take that information and make your next best decision.
Yeah, that makes sense.
So there is certainly an art to what we do, there, but yeah, sometimes we like, okay, we're not sure. We're going to go with this because it's well tolerated and they haven't tried it before.
See if it works.
We'll
Yeah, that's
see.
understandable. That's understandable. You know, it's not a cookie cutter treatment. Everyone's different. Everyone's going to be different. So it's understandable.
Definitely.
So now, earlier you again jumping back again, you had mentioned something about having a proper diet helps. So
Mhm.
I know that mental health plays a lot on physical health as well. Uh, what? So can you discuss the relationship between depression and physical health? Like, is it? How do they work together, and how do they combat each other?
So I fundamentally we worry about in the inflammatory process. So anything that's causes inflammation in your body has a risk causing inflammation in your brain. And so, so in a sense, is anything that's bad for your heart also bad for your brain.
Hmm.
And when, let's say if somebody has diabetes and the diabetes is not well controlled, that's bad for your brain too. That makes a risk for depression higher, makes it harder to treat depression, and vice versa. If you have depression, you're at higher risk for diabetes, higher risk for having higher blood sugars if you already have diabetes. And
Mm-hmm.
so everything's a balance. And really, we're looking at inflammatory processes. So, in general, foods that are considered anti inflammatories and things we're used to, like, omega-3 fatty acids are good, or leafy greens are good, as far as just overall helping yourself.
Yeah, kind of
And
seems like
are and are
it's all kind of
all
dependent on each other.
and
Mm-hmm.
all
All
interconnected.
intertwined.
Yes.
Yeah.
Yes.
Interesting. Interesting.
So
Now,
this may be, go ahead.
I want to ask you, you know, when did you know, was it at an early age that you felt the draw to you wanted to help people, or was it, what was the switch for you, Doc, that was like, this is the line of work that I want to get into? Was it, was it maybe a family member that inspired you to get into the line of work? I kind of want to dive into why you're sitting here, and obviously you work with Palms for the last 2.5 years or what have you, but why are you here? Like, that's what I kind of
Sure.
want to know.
Good
Sure.
question.
So, I think that desire to help has always been there, and maybe you model after the positive people that you see in your life. You see
Uh-huh.
how they're interacting and with the world and treating the world, and other people, say, for instance, my pediatrician, I had admired him and say, okay, that this is, interesting, and maybe this is what I want to do. And so you've had some positive influences, but um, you know, going into medical school and had no real idea what psychiatry was about or what it was
Mm-hmm.
like. And it wasn't until, you rotated into the going into the clerkship for psychiatry, and after the first week and the patients you're treating, the people you're working with, and you say, I think I kind of like this. And then you give it a little more time, and
Hmm.
uh, I definitely
You
like
found your
this. And
calling.
then,
Yeah.
yeah, and then like, this is what I want to do. So I always laugh and remember when I told my mom that, hey, Mama, I'm going into psychiatry after rotating through it. I was like, just really enjoy it. And she asked me if I was still going to be a doctor, and I said yes. She had wanted me to be a pediatrician,
Right.
and I
She's
said
proud of
yes,
her
I'm still
boy.
going to be a
Yeah.
doctor, and
Yeah.
so we just go forward, and it's been no regrets. I mean, through medical school you end up doing more rotations, and it just confirms this is what you want to do.
That's a fantastic story. Now, one last question, and then I mean I'll let Chris finish the show, but one last question I have for you is you treat people on a daily basis dealing with, you know, like the topic of the show, depression, right?
Mhm.
After hearing so many stories on a daily basis and it compounds and it's, you know, you're hearing everybody's worst every day, all the time, multiple times a day. Does that take an ill effect on you as, you know, as Michael? Like, what do you do to say, hey, I'm walking out this door and I'm not going to think about the day. I'm going to leave it here until tomorrow. Like, how do you condition yourself to where it doesn't start taking a toll on you, everybody else's, you know, issues and you know, their problems?
So one of the things I say, and you know, and I even sometimes tell this to patients, particularly with depression, is you're down stuck in a hole. Now I can come to the edge of the hole. I can try to help you out. I can even put my arm down in the hole and try to pull you out, but I can't get in that hole with you because otherwise we're both stuck.
Mm,
So I work that approach and you know and try to help as much as I can, but to recognize that yeah, I can't leave parts behind, you know, and so you got to maintain appropriate boundaries. You got to, you know, you definitely have to keep yourself okay because otherwise you experience compassion fatigue.
yeah. Now
And then it'll affect what you do.
we had a guest on a couple of weeks ago,
Oh,
and I
from
remember she had said something that was interesting, that the way she combats it for her personally is that she gets social. Like, she needs to be around friends. And so she tries to go out as much as possible, like, you know, drinks or birthday parties or events or whatever. You know, she tries to go out of her house and be as social as possible because that helps her combat that that you know what we were discussing, for her not to get into that hole. Is that something you do as well?
No, but it gets back to knowing yourself.
Okay.
So know who you are and what works for you. And so, you know, more likely that person is extroverted
Mm-hmm.
and I'm much more introverted.
Okay.
So the idea of going out to parties and whatnot, and this is not a criticism at all. It's that
Yeah.
individual need is that sort of thing is an energy expenditure for me.
Mm.
So I'd rather turn inward, reflect on things, and my approach is learning things, doing things, maybe
Yeah.
having peace and quiet. You know, so it's finding out what works for you.
Yeah. And that's respectable.
And so,
Yeah.
so yeah.
That's awesome.
Mhm.
That's awesome. Well, Chris, we got a couple more minutes left on the show. If you got anything, you know, any last questions?
yeah, this might again be another wormhole, but you know, as a psychiatrist, you can't do everything yourself. You got to have your support staff. So how do you collaborate with other healthcare professionals that are your support staff to make sure that a patient's taken care of?
I mean, you definitely have to have open lines of communication. You have to recognize that we are all on the same team or should be on the same team and all should have the same goal. And this is this other person's well-being. And so we're just trying to work towards that goal. And even if we were to disagree, I mean, if we're on the same, you know, working toward the same area, then you know things will line up.
Mm-hmm.
You know, so yeah, you need to rely on your nursing staff, your therapists. They're your eyes and ears too, and you compare it to what you're seeing, what the individual's telling you, and then you try to compile it and make your best decision.
Very well
Awesome.
worded. Yeah,
Yeah.
thank you. You know, Dr. Hernandez, I know I had a blast. I know Matt always has a blast on these shows as well. I want to thank you for stopping in and being able to have this conversation with us. I know our listeners are enjoying it as well. Matt, you have anything you
Sure.
want to say?
I appreciate you, Doc. And like I said
Oh,
off air,
absolutely.
I think you're about to hit the circuit. I know you're an introvert, but I think you're about to be really popular because you brought the energy. I'm definitely not depressed today. So
Well,
kudos to you.
we only got to one of the less common symptoms of depression.
Yeah, I'm already planning part 2 of
Oh
Dr.
yeah.
Hernandez.
You're
We already
coming back.
got
I
the
told you
syndrome.
you're gonna make the circuit. You're coming back. You're definitely coming back, Doc. You're welcome back anytime you want.
All
Yeah.
right. Well, thank you so much for having me. It's
All
been
right.
a pleasure.
Take care, Doc. Till
Okay.
next week,
Uh-huh.
guys.
All right.
Have a good one.
Like we weren't supposed to come up with something this clean, like something happened.